Hi, I'm Dr. Khurrum Shaukat Yusafzai. Today's video is very interesting. It's about the cancer. Cancer is described as the cell which continue to grow and they never stop growing and they become like a big tumor and they start metastasizing and spreading to the whole body. And because of their rapid growth, they eat up the whole body energy and the nutrients and the oxygen, and they starve the normal cells of the nutrients and the oxygen, etc. So this is the definition of cancer and why it occurs because the immune system goes wrong, because normally your body has around 1500 cells, but these 1500 cells are kept in check by the immune system, and by the end of day they're all eaten up by the immune system, so you don't have a cancer. But in the people who are diagnosed with cancer, the cancer grows from 1500 cells to millions of cells, and they're picked up by the biopsy and the other kind of tests, and then we say the person is diagnosed with the specific cancer. So globally around the world, there is no cure for cancer, and people are clamoring to find the cure for cancer. Many experiments are happening, and hyperbaric is one of the treatment for the cancer. Before, it was thought that hyperbaric treatment can only reduce the bad effects of chemotherapy, radiotherapy, and immunotherapy, which are the standard treatment for the cancer, because in radiotherapy the body is bombarded with radiation, so the cancer cells which are abnormal are friable and weak, so they get they are removed because they become dead by the radiotherapy, and the normal cells are spared. Similarly, in the chemotherapy, they give the patient slow poison called the chemotherapy, and that slow poison destroys the cancer cells which are weak and friable. And similar is the case with the immunotherapy. So these kind of therapies used to do a lot of bad effects on the human body, and there would be a lot of side effects, and the person would think that it's better to die from cancer than to have the bad effects of these radiotherapy, chemotherapy, because they would destroy the normal cells. Like when you are bombarded with extra radiation, you can get fibrosis of different body organs like the rectum and the bladder, and you would have bleeding in the urine and in the stools and the poo poo. So the thing is that uh, hyperbaric oxygen treatment was considered as a adjuvant therapy where it would lessen the bad effects of chemotherapy and the radiotherapy, and that was what we knew for a long time. But then came 2020, and the Nobel Prize in Medicine was taken by some hyperbaric doctors who explained at the molecular level when the cancer occurs, the carcinogenic factors destroy the DNA inside the cells, and when the DNA is mutated or altered, it causes the bad effects in the cytoplasm, and they produce the bad protein which we call the cancer. So, hyperbaric oxygen therapy is also known as epigenetic treatment, that it cures the DNA which has gone wrong and producing the cancer. So, this was known and this was explained in 2020 by these brilliant scientists from America and UK, and they got the Nobel Prize for that. So now we know that the hyperbaric oxygen therapy, apart from decreasing the bad effects from the chemotherapy and radiotherapy, it also uh, heals the DNA, and the DNA, when healed, will not produce the cancerous cells. So this is wonderful. So what it means, I would tell you that hyperbaric oxygen therapy, HBOT as we call it, it can cure the cancer. It can directly cure the cancer, reduce the cancer. It can also prevent the cancer, because if somebody has genes like the BRCA genes in the women who get like cancer of the breast and the uterus, uh, it's beneficial for them to have hyperbaric oxygen therapy as a measure to prevent the cancer from coming, because they can also have the breast cancer gene, they can also have the cancer of the uterus and the ovaries, and some other cancer can also happen because of the BRCA genes bad effects. So if you take hyperbaric oxygen therapy, you can prevent the bad effects of that gene, because hyperbaric oxygen therapy is known to control the bad effects of the multiple alleles. Like, multiple alleles are actually two sets of genes, the good one and the bad one, and the effect of these two genes are occurring on the body. And allele is described as a set of genes, because not a single gene will control any element in the body. So the multiple alleles bad effect is controlled by the hyperbaric oxygen. Like, even if it can't change the DNA and the DNA is bad, it will stop the manifestation. So that's very powerful, because no medicine in the world can do that. Very some experimental drugs are under process, but not same like hyperbaric oxygen therapy. So that is how the bad effect of genes is prevented, and you can prevent cancer, and you can prevent a lot of bad things through hyperbaric oxygen therapy. Now comes to the bad effects of chemotherapy and radiotherapy. As I explained, when the uh, radiation is giving, it's produce a lot of free radical ionizations in the body, and hyperbaric oxygen, and because of these ionization and free radicals, the body has a lot of inflammation, and the body has already having a lot of inflammation because of the cancer effects and the effect of the immune system firing up to control the cancer. So these kind of inflammations are also known to be controlled by hyperbaric oxygen therapy. So that's how it controls the bad effects of chemotherapy and radiotherapy. And then it heals. Like, how it heals by increasing the stem cells. The stem cells in your body, if they are less and they're produced in the bone marrow, in the brain, and some other parts of the body, and these stem cells are increased by 1500% by the hyperbaric oxygen therapy. And it will also increase the immune system by 300%. So when you have 1500% more stem cells, and your own stem cells, which is in your own body, because in the stem cell therapy, which is becoming very popular and not available everywhere but available in some parts of the world, you get the stem cells from a donor. And when you get it from the donor, there can be rejection, but in a hyperbaric oxygen therapy, you get the stem cells of your own body to be increased. So that's a lot better. That's revolutionary. And the other effect, which the hyperbaric oxygen therapy is reducing the edema, because when the inflammation is there, the whole body has edema. There's a lot of water accumulated, and because of the edema, the blood vessels are compressed. And when the blood vessels are compressed, the blood flows poorly, and when the blood flows poorly, the oxygen carried by the blood also is not supplied to the body parts, and that effect can be reduced by reducing the edema. So hyperbaric oxygen therapy is so powerful, it will go to every nook and corner of the body and release that inflammation and edema, and it will do it quickly. And because if you take some drug for inflammation or edema, maybe it will reach that nook and corner, or maybe it won't reach. But hyperbaric therapy immediately removes the edema and immediately removes the inflammation, and it has been observed through multiple investigations and tests that it does that. And the other good effect is that in some diseases, the blood supply of the body is compromised, like the smallest blood vessels, which are called the capillaries, they get blocked. Like people with diabetes, or because the people who are fat and diabetic, they also get blood pressure, they get cancers, they get a lot of diseases like stroke and other stuff. And even in cancers, if the growth of cancer is tremendous, the normal cells are getting starved of blood supply and the oxygen, because we have observed in the cancer there are metastatic their metastasis, and the metastasis occurs when there is hypoxic area. So why there is a hypoxic area? Because of the aggressive growth of the cancer cell, which is sucking in all the oxygen and also sucking in all the nutrition, and the normal cells are almost starving because the rate of growth of cancer cells is very fast. So the normal cells are saved by hyperbaric medicine. It will provide new blood vessels, new capillary will form. So even in the area where which is compromised, which is bad, which is destroyed by the cancer or anything, the new blood vessels will form, and the blood will flow there. It will take the elements which are needed in the healing, and the oxygen will also flow there. So this is a really powerful and great therapy for cancer. The only thing is you need to have a hyperbaric chamber, and you need to do it every day. And you have to do that. You do not exceed the dose that will cause side effects called oxygen toxicity, and you do not do less that the good effects are not provided enough. So, in order to have enough healing and not crossing the threshold to cause side effects like oxygen toxicity, you need the doctor prescription, because the doctor of hyperbaric medicine knows how to calculate the best dose of treatment, like which is best for you according to your disease, according to your state of disease, and how much you have healed, and how much you require, and how much you would need. So he looks at your investigations and tests, and then he determines the exact dose to be provided to you, and that exact dose he writes in a prescription, and that prescription is written for you in the beginning and also in the middle of treatment. He sees your test, and then he writes the prescription based on the prognosis of the disease, just like in other specialty like a medical specialist, because this is a medical technology, it's not a surgical technology. And it's painless, it's good, it's scientific. There are textbooks, there are hundreds of reference books, there are millions of research articles, and now hyperbaric specialty has evolved enough for you to consult a doctor. And I'm a hyperbaric doctor. If you need a consultation, you can contact me. My number is at the end, and I will write you a prescription based on how much dose you need of hyperbaric medicine. And the prescription will have the number of session, the pressure, and also the duration of treatment based on how your condition is and how much you need, and if you're fit to undertake a hyperbaric medicine therapy or not. So it's time you take the right treatment, and if you're away, the online prescription is available by examining your medical test investigations and case histories for last 5 years. So I hope you like my video, because it has been prepared by a lot of research and hard work, and also pains we take to bring you such wonderful videos to save your lives and give you relief and comfort. So I hope you like it, and also subscribe to my channel, because without that we will not be able to meet again among the millions of billions of channels in the media, social media out there. So I hope you subscribe, and also press the bell icon so that you are informed of the new videos, and hope to see you soon. Take care. Goodbye.